Today I'm going to demonstrate the Physio Lunge. It differentiates from a normal lunge because we increase the range of movement of the hip and activate the glutes more, as well as taking pressure off the knees when we go forward. If I show you a normal lunge, what usually tends to happen is the person drops straight down, which puts weight even between front and back legs. Now that's fine for quad strength and for normal lunges, but for some people it irritates their knees because it increases the patellofemoral pain and the patellofemoral loading, but also you don't get enough range of movement in the hip, so when you drop down your glutes aren't activating as much. So what we try to do is get people to do physio lunges, which means you have to move your body forward onto one leg. And this is great for people to try and improve one leg strength over the other. They've got one leg that's weaker, but also to get glutes that are not activating a little bit stronger, as well as taking the pressure off the patellofemoral joint and increasing that patellofemoral joint strength. So, a few things to remember. What you want to do is make sure your stance is wide enough. Never start with a sort of a short stance or you'll never get down far enough. So make sure your stance is as wide as you possibly can. Your weight has to go down through the front heel, not the toe. So as you drop down, you've got to make sure that that weight is actually going down through the heel, and you really think about putting weight through the heel and pushing up through the heel. When you do this, you'll get enough activation through that glute. The second thing I want you to make sure of is when you drop down, that you take the weight out of the back leg. Okay? So as you drop down, think of putting 80% of the weight into the front leg, so your back leg is actually quite light, and then pushing up, and that makes the whole leg do a lot more work. The third thing is, if you can see, I want your angles all the same. So my shin angle, my back angle, and my back leg angle are all going to be on the same angle going forward. And what this does is it again keeps you bending at the hip, so I get maximal bend out of the hip, and making sure I get minimal patellofemoral pain loading. So as I drop down, my back is flat, my shin and back are the same angle, and I can push up through that front leg, which gives me that activation and power through the back of the leg.